The Department of Planning, Monitoring and Evaluation is today launching its first edition of the COVID-19 Country Report in Pretoria. This report records measures and interventions that the country has adopted to combat the spread of the COVID-19 virus and its related socio-economic impacts on the country. Let's take it there live.
Lives, inspiring a nation. NRF, through its strategy, partnerships, planning and partnership division, was able to mobilize more than 90 experts from multiple disciplines to assist in the critical reflection upon and measurement of these interventions adopted by government, and to look at how we managed and responded to combat the spread of COVID-19. So, as in many countries across the globe, the academic and the intellectual depth has been at the center of developing collaborative solutions to the pandemic, and usually at very high speed. Turnover, decision-making, data, evidence has been at the core of this. Thirdly, the issue of science to policy, and to see science to policy in action. The unprecedented impact of COVID-19 has redefined at its core the nature of our societies. And this initiative showcases and amplifies the role that academics can and have played in the policy sphere. One of the objectives, as we heard of this report, is to inform current and future decisions on governance and pandemic management. And evidence-based policy making should remain at the core of these intended outcomes. And lastly, but no less important, recognition of the value and the importance of communication and science engagement. Public awareness of science and science engagement form part of the NRF mandate. And as the public funding agency, we are indeed at the crossroads of redefining how we fund, how we conduct, and how we communicate science with broader society, including how we engage in debate on science and science-related issues. So it's very positive to note in this volume of work that we have considered the inclusion of civil society responses, input from wider audience across a wide range of stakeholders, and overall, the vital role that communication and engagement played over the pandemic in negotiating the changing relationship between science and society. In conclusion, I want to thank DPME, GTEC, and the Minister in the Presidency for commissioning this body of work. I would also like to thank the multiple policy and disciplinary experts and teams in South Africa and beyond for the tireless contribution that have been made to make this report a reality. As the NRF, we appreciate your trust in us as a knowledge partner with government. Congratulations to all who were involved in getting us to this launch today. Thank you very much.
Thank you very much, Dr. Damos. Damons. Yes. Thank you very much. Next is we are going to hear from the Minister in the Presidency, Minister Mondli Gugubele, who is the Minister in the Presidency. When I want to be different, I say he is the chairperson of the National Planning Commission. And he is also responsible for all the work that we do in the center of government. He is also leading the work that is done by Statistics South Africa. He leads the work that is done by GCIS. He leads the work that is done by SSA. So he is the minister in the presidency and the minister that leads the work that all of us do. So as he's going to speak to us about this project, I am sure he's also going to assist us in terms of how this country should be able to look forward beyond COVID-19. Minister, we are in your hands.
Program Director, Dr. Masiteng, who is the Acting Secretary of National Planning Commission Secretariat, representatives of partner institutions, Ms. Ronette Angela, and her warm words of welcome, Acting Head of Government, who is the Acting Head of Government Technical Advisory Center, commonly known as GTAC, and Dr. Beverly Demons. I call it Demon. Who is the Group Executive of National Research Foundation. Mr. Robert, Director General in absentia, is here. Okay. I know by heart he is here. Of DPME. Honorable guests, ladies and gentlemen, I thought before I read my speech to say to Ms. Damons, when thanking us for having confidence in you, I was saying to Mr. Mashama, who leads the project, you speak as if we've got a choice. So failing to have trust in you, failing to have confidence in you, is to believe that we can take away trust from our eyes and hope to walk again. So we don't have a choice. Honorable guests, I thank you for joining us this morning for the official launch of the first edition of South Africa's COVID-19 country report. Some of you may be asking why such a report has been produced in the first place and what its relevance is to South Africa. There are two key reasons that I want to share with you. Firstly, at the onset of COVID-19, most of us knew very little about it. Scientific explanations were being offered about the epidemiology of this disease. Its outbreak was fast and received a great attention from the World Health Organization. All signs were indicating that we were about to face something major. For posterity, it was crucial that have a proper record of what actually transpired and how did we deal with it as a country. In other words, it's important to have this record, not only for the sake of record, but to ensure that we open South Africans, open their eyes to the capabilities they undermine, the national capabilities which help them to survive such a monster. The first edition of the country report, therefore, makes an important contribution by providing a descriptive analysis of what transpires based on the information available at a time. Of what transpired. My apology. The first edition of the country report, therefore, makes an important contribution by providing a descriptive analysis based on the information available at the time. Secondly, it is important that we pick up lessons from our collective experiences to improve things going forward. It is through learning that we can sharpen our focus in enhancing the capability of the state to deal with outbreaks and other forms of disaster going forward. This is in line with priority 1 of the current government administration, which is about building a capable, ethical, and a developmental state. With this said, I acknowledge the foresight of the late Minister Jackson Mthembu May his soul rest in peace, and the DPME team for recognizing at the onset of the pandemic that the research towards the development of a country report was needed to be initiated. The report as it is will be an important reference for future generations. The COVID-19 country report series, therefore, records the storyline and broad understanding of how South Africa has managed, responded to, and curtailed the negative effects of the pandemic. The immediate value of the research on the country report was derived during the research processes, wherein a space was provided for interactions among the researchers and practitioners from various disciplines and capacities to build the South African narrative on the COVID-19. As the research and analysis proceeded, various actors improved their understanding of the pandemic, and in the same way, lessons were being drawn, feeding into the relevant decision-making processes and helping to improve the response measures. The first edition of the report that we are launching today has reference period of up to March 2021, basically covering the first and second waves of the pandemic. As you would know, after this date, further waves of COVID-19 infections occurred, which were characterized by the periods of increased transmissions in the country, which were around July 2021, December 2021, and to a lesser extent, May 2022. Research has continued towards the production of the second edition, which will cover an extended period and update the analysis in terms of understanding the effect of the pandemic and some of the outcomes of the interventions implemented. Indeed, ladies and gentlemen, the scale of interruption was enormous. COVID-19 presented health crisis with major implications for the economy and society. There were sad moments as the number of deaths escalated, taking a toll on the families, friends, neighbors, and the frontline workers. Pre-existing socio-economic challenges of unemployment, poverty, and inequality were amplified. Among other things, valuable learning time at school was interrupted. The complex nature of the pandemic required a multi-pronged, multi-sector approach. Accordingly, South Africa's response was comprehensive and visibly led by the President and the Minister of Health. Overall, the response emphasized saving lives and saving livelihoods. The approach followed by South Africa was appropriate for local conditions and resonates with the conclusion of the independent panel for pandemic preparedness and response that was commissioned by Director General of World Health Organization, which noted that countries that successfully managed the COVID-19 pandemic adopted inclusive whole of society and whole government approaches by seeking scientific guidance, engaging health professionals across the board, including community leaders, and involving vulnerable and marginalized populations through a coordinated approach between national and subnational governments. Ladies and gentlemen, as we stand now, there are numerous lessons on what we have worked well and what have not worked well, and specific recommendations on what to do. With a year elapsed since the report's content was finalized, the context has changed and various decisions and actions relating to some of other recommendations have been made or acted upon. Data shows that COVID-19 infection rates, hospitalizations, and intensive care admissions due to COVID-19 have reduced substantially compared to the same period last year. To date, important steps taken include the announcements of Economic Reconstruction and Recovery Plan in October 2020, which signaled a shift in the focus of government towards stabilization and recovery. There has been successive lowering of the alert levels, culminating in the termination of national state of disaster in April 2022 and eventual repeal of regulations on the wearing of masks, limitations on gatherings, and travel requirements in June 2022. I still have to get used to life without a mask. The vaccination program in South Africa kicked off in January 2021 as a key defense against severe illness and loss of lives. To date in South Africa, about 36.8 million COVID-19 vaccines have been administered, with about 19 million people fully vaccinated. The extension of the social assistance program has been effected through the Social Relief of Distress Grant until 2023. These are just some of the examples. The question is, ladies and gentlemen, how effective was the overall country response? What are we learning from this experience? The good and the bad? What needs to be sustained as a lasting legacy? The evidence-based approach of seeking scientific guidance in considering the multiple trade-offs right from the start enabled South Africa to implement decisive and appropriate steps in managing the pandemic. The scientific research institutions and relevant advisory structures demonstrated their readiness and agility in this regard. The Disaster Management Act has provided a strong legal framework for managing the COVID-19 threat. The National Disaster Management Center and the National Joint Operation and Intelligence Structures were ready to provide the required response in line with their appointed mandates. Contribution of all social partners, the business, labor, civil society, philanthropic organizations, the media, and ordinary citizens was visible. The Solidarity Fund stood out as a successful partnership between government, social partners, and academia, working together to ensure national resilience and hope. In hindsight, as articulated in the report, we're launching today the constellation of all these structures and processes functioned well and complemented the existing national capability that was required for the task at hand. Implicit in South Africa's national response was the sincere consideration of the historical context of inequality and how it has manifested in the structure of society as it is today. Right at the outset, we could foresee that people living in low-income groups, those in informal settlements, larger families, those dependent on the informal sector, women, children, and homeless were likely to be more vulnerable to the ravages of pandemic. Policymakers and regulators crafted the country's response to the pandemic fully cognizant of these realities. Appropriate social safety nets were put in place to mitigate the negative impacts of the pandemic, especially on the most vulnerable. In the midst of all the disruptions, new opportunities emerged, I beg your pardon. The quick transition into electronic and virtual platforms facilitated regular and efficient meetings between the delivery partners. These are the opportunities that emerge and an opening to greater capabilities at our disposal. This enabled government to find new ways of coordinating actions at various levels. Online meetings have now become a norm. Innovations in the data science, research, disease surveillance, epidemiology have strengthened the capacity of the state with regard to evidence generation, dissemination, and use. South Africa was effective in using its international relations to access technical, financial, and human resource support from the international community and serving as a strong voice advocating not only its interest, but the interest of the African continent and the developing countries. The government communications approach has been inclusive, reaching different population groups in different languages, different media, digital and community-based platforms, and now serves as blueprint for government communication going forward. The country scaled up its industrial capability to manufacture essential items such as ventilators, vitamin supplements, oxygen, intensive care units, testing kits, and establishment of facilities to produce COVID-19 vaccines. Equally, there were challenges encountered. Amongst those, the unevenness in the state of readiness and capacity of the various disaster management centers in various parts of the country became apparent. The pandemic exposed existing coverage and reliability gaps with respect to basic amenities and spatial inequality. This highlighted vulnerabilities of specific communities to several risks associated with gaps in the provision of water, sanitation, healthcare, food, transport, ICT services, especially for online learning platforms for the majority of learners. The corrupt practices and collusion between different actors undermined confidence and generated widespread public anger. Examples include overpricing of essential items, abuse of emergency procurement, looting of resources, diverting of social assistance such as food parcels. There were worrying trends regarding negative experiences of women, including incidents of gender-based violence. Many lessons, ladies and gentlemen, have been learned, and much can still be explored as we engage in economic recovery process. Greater attention is required in certain areas, and some of them require immediate policy responses. These include support for small businesses, government interface with informal businesses, the effectiveness of measures to counter GBV and femicide, etc. Relevant departments must integrate these into appropriate programs. Some of the issues require a response over medium to long term. I acknowledge contribution made by researchers recruited by the National Research Foundation in partnership with Government Technical Advisor Center, GTEC, and the DPME in producing this report, which demonstrates successful collaboration between government and academia in generating knowledge. South African government will forever be grateful to all who have been on the front line every single day fighting the COVID-19 pandemic. I thank you.
Thank you very much, Minister. We would like to highlight that if there is one thing that COVID has taught us in this country, is that it started as an epidemiological or a health problem that ended up as a disaster in our country, but all it did was giving us everlasting lessons for the future of our country, especially for sustainable development. It has made sure that one thing it did was it laid bare the structural challenges of development in the country. It made us understand better poverty issues. It made us understand better what it means when people lose jobs in large numbers. It made us understand what it happens when the economy is not able to create jobs and people lose jobs and people start to go and stay home with their children and there is nothing to eat. So it has really laid bare the understanding of sustainable development in the country. We might not be thankful to it, but we can be thankful to the lessons that it has created. Minister, as you say, one thing it has done is that it has created opportunities, it has created conditions for learning, it has also created our understanding of how to work together. It has created, for an example, what we are dealing today is that the challenges of development are so big that none of us can work alone and create an environment to deal with them alone. As such, these types of compacts that we see, we hope that they can be sustained. This partnership between DPME, GTEC, and NRF should be part of sustainable moving forward. It's not going to be a project. If you run out of project, we will provide. we need to move into the future, and we need to be looking at what does it mean for the future that the country lives with COVID. So those are the projects that if we run out of ideas for evidence, Mr. Mashamba will keep providing, such that we sustain this environment of creating knowledge. Without any further ado, I would like us to call on Mr. Mashamba, who has been the project sponsor, the leader, and the person who has traversed and really made this happen. When we started, we only played advisory role and made sure that we play and assist on the side, but I think everything has been carried on his shoulders. Mr. Masham.
Good morning. I feel a bit short.
You feel?
It's because, hopefully you can see me, but I'm pretty short. Thank you very much, and good morning, everybody. Program Director, Minister Gungubele, the representatives of partner institutions, GTAC and NRF and DPME, the authors and researchers. I understand we have about 30, about that number, connected online, and we have 4 that are sitting in the audience here. Also to acknowledge thank you very much. That helps. To acknowledge also the generosity of National Research Foundation for providing this venue. The peer reviewer also from the World Bank that helped to read through the report and make comments, giving us a sense of how does this report stand in the international space, especially compared to the other related work that's being done in that space. I must say the venue is very beautiful. We appreciate that. Just to take you through the content of the report, there's something here on the screen which I want to remove. I hope I won't, so that I'm able to read. Okay, yeah, I've removed it. Thank you very much. We can move to the next slide. I'm going to give an overview of what the report contains. Obviously, the report has some 700 and something pages. It covers a whole range of themes. I'm not going to cover everything, but to walk you over the key issues in the report, just to give you a sense of what's contained. You will also get a chance to read the report because we are going to make it available. You can download specific chapters of interest on the website, or you can read through the whole report to get a sense of everything that's there. We can go through the slides. The next slide, please. The overall aim of the COVID-19 country report is to record interventions adopted by South Africa to combat the pandemic and its negative impact. We thought at the time when it was started, as you've heard from the speakers that spoke before me, that the magnitude of the COVID-19 pandemic was not something that we could just leave as that. We knew very little about it, but now we are in a better space based on this research. We're in a better space that we have actually interacted with the knowledge spaces to understand how is it affecting the country and what are the policy choices we can derive from having done that analysis of understanding the effects of this pandemic in the country. So the report will also go into contributing to history, that 20 years down the line, people will still be reading this to say this is what happened in South Africa and how South Africa has actually responded. But now, I can guarantee you, there has been insights drawn from this work throughout the research process that has actually informed and fed into policy processes and ongoing still. There is work that we draw from this analysis to feed into work that is still policy development as it unfolds. So there are important lessons that are being drawn from this. The report covers a range of chapters. You see there in the screen the leadership, governance, institutions. I'll go through each one of these in summary. Let's go to the next slide, please. Otherwise, just to recap on the methodology, the report was produced through a partnership, as it was explained, but also to ensure a balanced perspective from multiple angles. We commissioned independent researchers to do independent assessment of what's taking place in the spaces of specialized areas or themes that we've identified. And the report also drew from a wide range of evidence. There were interviews that were conducted. There was desktop research. There were in some parts. Each chapter actually draws from different sets of methodology, data analysis, you name it, and also interviews that were done with non-government experts, with people in government that are in positions of authority, leading certain processes. So it's an amalgamation of all this and triangulation of various forms of evidence, and it has been tested through validation workshops with stakeholders of relevant chapters, and also presented at highest levels of government, including the National Corona Virus Command Council, where it received support. And then let's go to the next slide, please. This slide actually gives a snippet of what could have been a timeline. You can actually extend the two slides that reflect the timeline of what actually happened in terms of the rates of infections, the deaths, also key decision points where government was actually introducing new regulations or key events that actually unfolded. Although people will remember, when you go around and ask, what do you remember about the COVID-19? Many people, the first thing that comes to mind could be the lockdown, could be the wearing of masks. Another one will remind you of the irritation concerning the use of sanitizers and all these things. So we have gone through that whole phase. Next slide, please. I won't go through the details of this. It's available in the report for people to read. But actually, something else to highlight here is that throughout the time covered through this report, from March 2020 up to March 2021, there has been a tightening of restrictions, and then a reducing of those restrictions at times, depending on the kind of advisories that were being generated at the time. Let's go to the next slide, please. Just here to highlight in short the overview of the impact. You would all know that whereas this started as a health crisis, it had far-reaching implications for the economy and society. It came into South Africa at the time when the economy was very fragile. We lost 2 million jobs, trade and investment halted, and also we see from the report that the pandemic and the lockdown itself amplified existing economic challenges. You have had the program director indicating its implications for the development agenda of the country. It set us back in terms of employment, the gains that we're starting to make, employment, poverty, and inequality. Some of these statements are already read in the various speeches that have already. But in terms of the economic sectors, you'll find that there were certain sectors that were more exposed than others to the ravages of this lockdown. Let's go to the next slide, please. Over here, you will see, just in the health chapter, which deals with giving an overview of the health response in the country. I've created a picture there, the one that has a circle. If you read it from stage 1, you'll see that from the preparedness stage that this was the 8-stage implementation framework that was followed in South Africa, wherein we had actions to prepare and prevent in the first place. But then we move quickly to the space where actions get taken to quickly respond and contain the spread of the outbreak. And in that, where people remember is stage 3, the lockdown with curtailment of human interactions, where you couldn't even visit your neighbors. It was a very difficult time. Then we move now to mitigations. These steps, these stages, actually, they do function in interdependent ways. And then on the right side, you will see the alert levels, just a reminder of what they meant. Let's go to the next slide. In the next slide, you will see that whereas the national lockdown was implemented from March 26, the alert levels were adjusted from time to time, up and down, from extensive restrictions to easing of nearly all restrictions. Now we are in a moment where there are no longer restrictions. The early lockdown, in a sense, it actually helped the health sector to cope with the pressure at first. But then we also note that the provinces of Eastern Cape and Western Cape experienced pressures in the initial period. But when the new variants came through, they created certain complications in the whole space, which are noted in the report. That especially the second one, during the second wave, the B1351 strain actually introduced a whole lot of dynamic in the space. But you'll find that in this chapter, recommendations are made for continuing with some behavioral preventative measures. That was at the time because we were still at the height of the pandemic. Indeed, government made decisions on how those behavioral preventative measures, such as wearing masks and use of sanitizers and all those social distancing, they continued for quite a while. But going forward, given the context of the national health insurance and the objectives of universal coverage of health systems, there is a lot of work that needs to be done in this space to claw back, also to deal with the issue of backlog in the capabilities of the health systems, but also building better going forward. So further research actually was recommended in this area around the issue of excess deaths, that we needed to understand a little bit more better that space. You do know this recommendation was made around March last year. That research was done actually in South Africa. There was continuing work to understand the trends and the drivers of those excess deaths that were happening at the time. Next slide, please. On the next slide, we speak about the leadership, governance and institutional arrangement. In that, that chapter actually focuses on how South African government structured its response to COVID-19 crisis, particularly during the early phases. It also reviews governance structures and the institutional arrangement that were put in place to deal with the disaster. What we note in this one is that South Africa is widely recognized for quality of political leadership in managing the pandemic, moving very quickly and decisively in terms of intervening to actually curb the spread. The numbers rose very rapidly. It needed swift action. The Disaster Management Act serving as the most appropriate legal basis for managing the pandemic, because it was realized very early that ordinary legislation couldn't have enabled the government to do what it did, to impose restrictions also and all those kind of things. But in the same space, you would think that the report also note that the Disaster Management Act does have certain strengths and limitations. It's getting tested all the time. The recent floods that have happened, you find that they are certain things that policymakers and lawmakers would continue to think about in terms of, does it enable us to respond, to be more prepared, and also to sustain going forward. So there are recommendations to amend the DMA, taking lessons from the pandemic itself. So when that opportunity arises, we should be drawing from this work to inform what goes into the amendment. And also, the state of disaster, what comes strongly in the report is that state of disaster must not be prolonged. It must be meant to deal with that purpose that it was introduced for. So it must be as short-lived as possible and be lifted as soon as the threat is addressed. Then also issue of how do we strengthen the advisory structures, that they should look far and wide to get whoever is supposed to be involved in such structures to be involved. Next slide, please. There were legal and regulatory responses that were assessed, as well as the human rights that have arisen from the introduction of the various interventions. There were several measures that were introduced, whereas the objective was to save life. They also introduce new dimensions to, new dynamics, reflecting that there is complexities in these things, that government needed to balance the legal and ethical aspects of limiting people's freedoms with the issues of public interest, of promoting public health objectives. That, for example, if I'm restricted to stay at home, I feel bad about it, that I cannot go to where I want to go all the time when I want to go. But then again, if I don't comply to that, I contribute to the spread of the pandemic as such. So there were several cases, legal challenges, court challenges, where various members of the South African community have actually challenged government. We have listed examples of those, and in a number of these, you would find that the courts have determined that government in the main was right, but there were cases that at the time of writing of the report were still ongoing. So we'll need to look into the outcomes of those decisions. But some very heartbreaking times also during the pandemic that are highlighted in the report. You remember the case of Collins Khoza in Alexander, which is one of those that have arisen. The issues around police misconduct that have also been highlighted. The issues of tobacco, which made big news in the media, and then it dragged on for quite a while, including also the issues of access to social assistance, the criteria that government has actually designed to support businesses and all that the Minister of Tourism and the Minister of Small Business were actually challenged on those things. So there was concerns around corruption that complicated the whole story. The overpricing of items, essential items, the abuse of emergency, and the looting of food and essentials. That was very sad. So, and then the investigation by the Auditor General, which showed like a swift response to now try to put some order into the whole system. Next slide, please. In the space of communication, I think in the minister's speech has already highlighted some of the things. Suffice to say that there are international frameworks that were used as a basis for the analysis here, because they provide sort of like a clear, concise guidelines in terms of how to communicate during times of pandemics. The World Health Organization and UNICEF and also the Red Cross has those guidelines, which were actually a very useful reference point for the assessment of what transpired here. You would all remember the family meetings drew quite a lot of viewership. You would remember also the activities of GCIS. There were media briefings that were run, which served to really provide a useful basis for getting updates on what's happening. The communication of the signs of COVID-19. There were various, including the Minister of Health, various experts in the field, educating, informing, letting us know new things that we didn't know. Clarifying also the myths connected to these things. So it was a very concerted effort in the communication space. The role of civil society organizations, which was a very important channel to transmitting information to their constituencies. So in this space, there is a blueprint which GCIS actually acknowledges that there is a important lessons that can be taken in actually improving government communications going forward. The use of different languages and various platforms are actually very useful. Department in the space of education, in the next slide you will see that there were competing voices, very emotive, around issues of closure and reopening of schools, and then exposing these wide inequalities that existed in our education systems, that when an option of hybrid or online classes came through, it was only a few in the whole majority of schools in the country were able to adapt very quickly to online schooling, whereas the majority that lacked access to internet and these facilities of online education were left behind. So that is an area that still needs attention going forward. It comes very strongly in the report. In the space of higher education, post-school education, they took early recess, which it actually made things easier for them to manage the pandemic. But also the higher education space, the higher health coming in very handy in that space. They highlighted in the report many institutions helping students to vacate, and also issues of repatriation of a student from other countries. But going forward is that what needs to be looked at, according to this report, is an issue of adopting the programs to address the lost learning time. Department of Education, Basic Education, has actually paid attention to that, and they have programs to deal with that. The issue around improving school infrastructure is still a hot one. It needs a lot of attention. There is a draft policy that's out for public debate, for public comment, which I think learning from this, you can actually make important input into that to define what should actually exist in schools for them to be good places of learning, ideal places for learning. And then issue of just social justice as to policy decisions affecting schools. When you decide about reopening of schools, it was said that you need to consider the different circumstances under which these schools and learners are getting exposed to. And also an issue around families, that children, whereas at first they were not the face of the pandemic.
The Minister and the President, Simondla Gugubele, there with his team presenting the first South Africa COVID-19 country report, the first edition. Perhaps you can talk with us at the agenda_SABC, just in terms of what your takeaways have been in the country's response to COVID-19.